The phase 2 trial of the HIF-2 alpha inhibitor belzutifan, or MK6482, in combination with cabozantinib is certainly intriguing, but it's very, very preliminary, the results. And so I think it has to be taken with a grain of salt. So in the analysis that's presented, there's 41 patients in the efficacy data set. Those are patients that had a minimum of around 6 months of follow-up at a minimum. And the thing to remember here is they were pre-treated with really modern IO-based regimens. So these are patients that mostly received an IO-IO and IO-TKI regimen. And so when we look at the efficacy of this drug combination, it really is applicable to modern times, because these are really regimens that patients would get in the first line, and then this is a drug combination, belzutifan plus cabozantinib, that they might receive subsequently. And so the main questions here are, what is the efficacy and what is the safety involved with this? So we can start off with the efficacy. Now, the overall response rate, I think, is encouraging, but again, it's early. So the overall response rate is 22% that was recorded, but there's an additional 12% of patients that have unconfirmed partial responses. So that number we might see go up. I think impressively, though, there were about 90% of patients that had disease control. That means either response or stable disease. And overall, 88% of patients had some degree of tumor shrinkage. So there's certainly a signal there for efficacy, but it's pretty early on. Now, there is a median progression-free survival reported of over 16 months, but again, that's incredibly early because some of the patients had fairly minimal follow-up. The median follow-up was well less than 16.8 months, and so that number could fluctuate. And so for the question of, is it efficacious? I think the short answer is promising, but a little too soon to tell. Now, the next question is it safe? And I think overall the regimen was reasonably well tolerated. So there were no grade 4 or 5 events. There were a number of grade 3 events, and upwards of 60% experienced a grade 3 event, and about 15% had to discontinue one or both drugs due to treatment-related adverse events. That's actually not that far off from cabo alone. So I think, is it a regimen that could be tolerated and safe? I think the answer is yes. And so when we take a step back and look at the big questions for this trial, is this a combination that is tolerable, that you can actually give to patients, particularly in this sort of post-IO based regimen setting? I think the answer is yes. The question, is it efficacious? Is this something that's better than cabo alone? I think it's a little too soon to tell. I think there's some interesting signals of efficacy, but we really do need longer follow-up to know for sure.